Go.
Okay, we're going to start off with the hip. I'll run through it just as it is in your workbook. First of all, observation. So I'm looking for any bony deformity, any muscle wasting, anything that's obvious that's telling us a sign of an injury. So I come from behind, I look at the hamstrings, knee alignment, calves, looking if one foot's turned up more than the other, comes to the front, looking at quads, looking at hip level, looking at knee level, looking at shin alignment, looking at foot alignment. Also looking for any colour changes, any bruising, any swelling, any obvious signs of that. Okay, all I want you to do now is walk forwards and back towards me. Okay, turn around. Okay, do that a couple of times. Okay, and all I'm looking for there is any deformity, any obvious signs of a limp, any signs of Trendelenburg, any signs of pronation, any signs of valgus or varus of the knees, and any instability of the hips. Just take a step forwards. Okay, and just stand on one leg for me. Okay, what I'm doing there is just looking at hip level, back down. Just do that again for me, same leg. Seeing if the hip drops, so seeing if this right side of hers drops down, back to middle. Then the other leg. And again, see if the left side drops. Okay. From there, I just want you to stand on one leg and do a one-legged squat down. Okay. Again, looking at, do that again for me. So looking at thigh alignment, looking at knee alignment, seeing if the knee goes in or comes out. One more time on that leg. Seeing hip level, so seeing if the left hip is equivalent to a right hip, as you can see that right hip's dropped down. Okay, do the other side. So looking for the same there. One more time. Okay, and you can see the same on the other side, quite a large Trendelenburg. Okay. Just do a two-legged deep squat for me. Okay, and back up, and again we're looking for just general malalignment. You can see both legs pronate a little bit. Okay, and relax. Okay, lie on your back. Head this end. Because it's the hip, there's no real area you can palpate majorly. I give a quick palpation around ASIS, down through recfem. That's pretty much all the palpation you can do. Passive tests, we've got passive flexion. We do two ways. Straight leg to end of range, looking at her face and also for an elastic end feel, which is about there. Okay. Come round to the other side, and with a flexi. Range is there. Okay. Do the straight leg to test the hamstrings, do the bent knee to do the joint surfaces. So, medial lateral rotation, thigh at 90 degrees, medial rotation, again end of range, elastic end feel, lateral rotation, end of range, elastic end feel. Abduction, hand just above the ankle, opposite hand on the thigh. Walk away looking at her face, just seeing when I get an end feel and also any pain. That's about there. Okay. Resisted test in this position. We've got resisted flexion and extension, so just bring your knee up towards your chest, hold it there. The left hand goes on the knee, right hand on the shoulder, and just push towards me as hard as you can. Okay, and relax. Really important to get your legs in the right position, so as I'm pushing, I'm using my legs, not my hand. If I'm stood like this, pull against me, go on, pull as hard as you can. Okay, she's going to overpower me. That's a 20-stone rugby player, definitely overpower me. Okay, relax. Knee extension, hip extension. Lay about 45 degrees. Grab the leg like you're cradling a baby, keep the leg straight. Push down against me, but don't let your hips lift off the bed. Okay, push down, keep your legs straight. That's it, go on, push, and relax. Making sure when I do that, I'm using my back and my legs more than my arms, so in a squat position. Resisted ab and adduction, hands just above the knees. Reason being for that is we don't want to be down too low because if we've got any knee injuries that can cause irritation. Hands just above the knees, using the palms or the heels of my hands, fingers underneath the legs. Arms splayed out, chest quite close, and I want you to push out against me when I say. Okay, push out as hard as you can. Push, 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 push. And relax. Okay, that's abduction for adduction. Both the legs are touch. Hands inside the legs. Same principle, pushing against me as hard as you can. Go on, push, push, push. And relax. If they are too strong, you can work your way down the legs a little bit. Special tests, quadrant test or quadrant or scour test. It's the same thing, basically looking to test all 4 areas of the labrum. Start in 90 degrees hip flexion. Put my body weight through the femur. Lean on the femur. Come up, adduction and flexion and across. Any pain there? And then median lateral rotate. Come into abduction and flexion, median lateral rotate. Extend and abduct, median lateral rotate. Adduct and extend, median lateral rotate. You can, if you want, go all the way through the movement, median lateral rotating. It does the same thing. What you're looking to do there, that's your acetabulum, that's your femoral head. You're looking to kind of scour the whole surface basically with each bone. Favourite test stands for what it is. Flexion, abduction, medial rotation. So external rotation. Flexion, abduction, external rotation. I just explain to a patient, put that part of your ankle onto that part of your leg. And let your knee drop down nice and slow. And what you're looking for here, compared to the other side, is obviously reduced range of movement. So you can see your thighs about 45 degrees. Hand on opposite ASIS and gently push down. Look for any pain. Any pain there? Okay, and we're looking for pain across the front of the hip and or reduced range of movement. This side. Okay. From there. So both sides are even. Positive test on that would elicit symptoms of iliopsoas tendonitis or possible acetabular tear. So that, along with quadrant or scour test, could indicate intra-articular injury. Just lie on your right side facing that way. Resisted abduction, if we go like that. Just have both knees flex me a touch. Top leg straight, that gives her a bit of support. Resisted abduction, so if you found that resisted abduction in a supine position was too strong or too hard for you, this is the better way to do it. From here, hand above and below the knee. Use my body weight and I lean on when she starts to abduct. I don't lean on too early because if she didn't have any knee injuries, she will have afterwards. So push up against me when I say, okay, go. And it's just body weight, straight arms, go on, push, 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 and relax. Again, all muscle tests, we're looking for full muscular contraction. In the same position, special tests, we're looking for overs. So obviously resisted abduction, we're looking for your abductors. Overs, we're looking for muscle tension or muscle length of your iliotibial band. So relax your legs, same position as resisted abduction. Grab the leg as if you're cradling a baby. My upper hand on the lateral side of the ASIS. I abduct, extend, and then allow the leg to drop down slowly while my upper hand keeps the hip from rolling backwards. So I'm not allowing her hip or her torso to rock backwards towards me. Down. Positive test is if the leg hangs in the air like that. Okay. The shin or the medial side of the shin should be able to drop down onto the bed. If the ITB is tight, it's going to hold that in the air like that. Okay. Okay, lying in front of me. Okay, passive hip extension. We do this again with the knee flexed and with the knee extended. Knee extended is going to take the quads out of the equation. Knee flexed is going to test the quads. So to test the joint surface itself, hand on the anterior part just above the knee, hand on the lower back to stabilise. And what I'm going to do is just tip, as if I'm tipping like a teapot, until I get to end of range, which feels about there. To do with the knee flexed, put the quads on stretch, exactly the same position, but I just use my forearm and my shoulder to hold the knee in a 90-degree flexed. And when you get a stretch, okay, and where is that stretch? Okay, so front of the thigh. Resisted medial lateral rotation. Just bend your knees for me, 90 degrees, that's it. Keep your knees together. I want you to push your feet out like that when I say it. Hands on the outside of the ankles, push out against me. Come on, push, 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 push. And relax. So that's resisted medial rotation. And then lateral rotation, have your knees and ankles like that. Keep your knees together, push your ankles together when I say it. Okay, go. Come on, push, 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 push. And relax. Okay, resisted knee flexion and knee extension. We want to do that because there's two muscles that go over two joints. Resisted knee flexion will test the hamstrings, resisted knee extension will test the quads. For hamstrings, knee flexing 90 degrees, heel on the hand, or hand on the heel even, hand on the upper back, and I want you to pull your heel towards your bum when I say, there you go, as hard as you can, go on, pull, 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 and relax. Any cramp? Okay. Same as every other test we've done like that. Keep your legs in a good position so that we can use our legs and not our arm. Resisted knee extension, I'll come around this side so it'll be easier to show. Knee to 90 degrees flex again. Just come to this side of the bed to touch me. That's it. Use your arm okay there like that. Okay. Use my shoulder just underneath the ankle. My right arm goes around, goes to the side of the bed. Left arm comes as support. Then lean forwards to flex the knee past 90 degrees. And I want you to try and straighten your knees, so push out against me as hard as you can when I say, okay, go. Okay, go on, push, 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 push. And relax. Me doing it like that, there's no way she can overpower me. If it was a 20-stone rugby player again, me like this is in a good position. If I'm here, push out against me. Okay, she's going to start pushing me back. So make sure knees nice and flexed and you're using your body weight. Okay? And that's all the hip test.